Hi, my name is Lauren Parsons. I am from the Department of Pathology, and my Kinetic 3 Teaching Academy mentor is Dr. Allie Harrington. And the title of my capstone project is Viral Virtual Education, Developing a Virtual Lab Medicine Elective for Medical Students. As we are all well aware, in March, the COVID-19 pandemic hit hard with widespread impact across all areas of our lives, and healthcare education certainly was not spared by that. We found ourselves in a situation where medical students really needed opportunities for medical education because they no longer had the opportunity to learn face-to-face in the clinic or in the wards. So as a result, MCW's Curriculum and Evaluation Committee put out a call for online medical student elective rotations. We saw this as an opportunity, maybe for some resilience and some innovation in medical education, because sometimes you just kind of have to roll with the punches. So our objective then became to create a virtual or online pediatric-focused lab medicine elective to hopefully improve medical student understanding of the laboratory, of its resources, and of its role in caring for patients, while at the same time filling this educational need. With respect to construction of the elective, we first evaluated the current elective offerings by the Department of Pathology and used that as a framework. We brainstormed with other physician educators within the department, as well as within the Department of Pediatrics, to identify some needs and gaps. We reviewed the literature for previously published curricula, as well as for recommendations put forth by professional societies for the need-to-know laboratory medicine educational components that they identified. And then we examined the different educational modalities that we could incorporate to engage our learners. So ultimately, we developed a 4-week curriculum composed of anatomic and clinical pathology topics, 2 weeks dedicated to each broad category of anatomic and clinical pathology. And here are some of the topics that are covered in this elective. With respect to the different educational modalities that we utilize, we do remote slide review, essentially using WebEx and photography software on our microscopes to look at glass slides live with the medical students. We have didactic sessions, virtual slide review, both independently as well as with an attending physician, laboratory tour videos, recorded lectures, recorded animations, and then some independent learning as well. This is an example of one of our laboratory tour videos, specifically embedding in the histology laboratory, where one of our histotechnologists shows students one step of the process of how a piece of tissue becomes a slide. In order to look at how well this elective is achieving its objectives, we incorporated pre- and post tests by topic, little mini quizzes that the students take to assess pre- and post knowledge of topics. We incorporated an end of rotation presentation with a case or topic selected by the learner that incorporates both anatomic and clinical pathology into either the diagnosis or management of a disease process. And in order to assess medical students' own perceptions, we developed pre- and post-rotation surveys. So in conclusion, we were able to rapidly develop this remote laboratory medicine curriculum for our pediatric-minded medical students. We did our best to incorporate different modalities of educational methods so that we could engage our learners from afar. And thus far, as we've piloted the curriculum with rotating pediatric residents, our preliminary feedback has been very positive. So moving forward with respect to the practical considerations, this course is currently available for our medical students to enroll in. We have the potential to offer it at the regional campuses as well because it's entirely remote learning. And we will continue to use feedback and evaluations to adjust our course so that we can better meet the needs of our learners. With respect to the educational scholarship aspect of this, we want to compile this objective assessment data and the survey data so that we can analyze the impact that this course has on medical student understanding of the laboratory. And we anticipate that we will submit that once we have that data to one of our National Society meetings. So this is my entrepreneurial mindset as it relates to my capstone project. And this is my character artifact as it relates to resilience. Thank you very much for your time.